and why we care. Hi, my name is Abby Mergen and I chose Lyme disease for my semester project. Lyme disease is becoming more and more of a problem, especially with our rising cases in Wisconsin. We are a big outdoor and hunting state, so it is important that we're looking for ticks and being educated on next steps if we do suspect we have Lyme disease before it affects vital organs like our heart. First, I wanted to address why it is important, especially for Southwest Tech College students, and why we care to be educated about it. Wisconsin is one of the main hotspots for Lyme disease. These images are from the CDC and show very good information of how Lyme disease is becoming more and more popular, especially with the rise of our reported cases. In 1995, you can see the individual dots in Wisconsin for each case. There's just a couple clusters, but in all, our state is still white. But in 2010, our state is starting to fill up with more cases. But there's still a couple areas that are white, and didn't have any reports. But in 2023, our state is almost completely filled. This shows a trend increasing, and this is why we need to start making others more aware of signs and symptoms so we can get treated sooner if we suspect we have it. This image is another great example of risk areas that Lyme disease is more present in. As you can see, Wisconsin is almost all red, which means we are in a high risk area. According to the Global Lyme Alliance, most recent estimates are 476,000 new cases of Lyme in the U.S. every year. Scientists estimate that 2 million people could suffer from post-treatment Lyme disease at the end of 2020, and Lyme disease also has been found in 80 countries. So we can see a rise in more areas, more places, and that it's becoming more common. Borrelia burgdorferi is the bacteria responsible for causing Lyme disease. This is carried by a deer tick, or also known as a black-legged tick. Steps for getting Lyme disease start by being outside, typically in a grassy or woody area. This is where ticks tend to be. To actually transmit the disease, a tick has to bite a human or animal for 36 to 48 hours. The last step would be to report to your doctor any signs and symptoms to be treated. This would typically be treated with an antibiotic called doxycycline, and this process can all change depending on how early you report your signs and symptoms. This is a picture of the back. These images I included are important to look at and remember. This is what a tick typically looks like, and they're very small. In comparison, I put a picture of a tick next to a diamond. As you can see, it is as big as the letter D. And the next picture with the tick on the finger shows that it really does appear very small. The last picture I included shows how big the tick gets depending on how long it has been feeding. It's important to note, in case your doctor asks for further information, you can always show them the picture so they can get a better guess. Especially comparing it to day 1 to day 7, you can see there is a really big difference. This will help them figure out how long they want to prescribe antibiotics and what other treatment they want to include. This is a picture of the bacteria Borrelia burgdorferi, and as you can see, it is a spiral shape. Under a microscope, it looks like a mini spring. Then I also included the second picture so you can see it's coming from the mouth, which is where it would bite into the human or the animal. Next, it is important to note the symptom stages. Symptoms can vary depending on when you catch it, so it can change and develop depending on how long you have the bacteria in your system. So stage 1 is a couple hours to weeks. So the skin rash appears, it can, or does not appear. It can, 80% does have the bullseye skin rash, which is the telltale sign that doctors in the hospital think it is Lyme disease. You can also have chills, fever, fatigue, headache, stiff neck, muscle soreness or joint pain, swollen lymph nodes, or sore throat. Stage 2 symptoms are from weeks to months. You have chills, fever, headache, weakness, numbness in arms or legs, vision changes, heart problems, chest pain, and facial paralysis. Stage 3 is weeks to months or to years. This is arthritis, severe headaches, dizziness, chronic fatigue, insomnia, and then problems following conversation and processing information, and severe fatigue. So this is why it's important in stage 1 to really check if you do have these signs and symptoms so you can catch Lyme disease sooner, so that way there's a greater chance that antibiotics are going to work and you won't have any long-lasting side effects. So rashes. Rashes was one of the main side effects in stage 1. This is how they typically diagnose it and know that this is what you have. But 80% is the bullseye or the target, which is down to the left at the bottom. But it can look like a bunch of other things. So on these two pictures, we have blistering lesions. One looked like dots. One kind of looks like a fingerprint. We have blue-red lesions that could look like a bruise. To the image on the right, there looks like faint bruises, more than one rash. Those kind of look like fingerprints. So you can just see that it can appear a bunch of different ways. So it's important to note your signs and symptoms or find the tick on your body so they know exactly what it is and how to treat you. So the process is a lot easier. The first discovery of Lyme disease was in Lyme, Connecticut in 1975. This is when a cluster of people were experiencing uncommon arthritic symptoms. By 1977, they were calling these symptoms Lyme arthritis and linked a black-legged tick to this disease, which we saw that arthritic symptoms were common in later stages of Lyme disease on the previous slides. And then in 1987, it was a reportable disease. 1988, it got media attention, so a lot more people were becoming aware of what black-legged ticks are and what they lead to. In 1991, research became available and they started researching causes, effects, signs and symptoms, what they could do. In 1997, the first Lyme disease vaccine was made and became available. In 2001, they took the vaccine off the market because there wasn't enough profit or buyers off of it. Physicians didn't want to prescribe it or give it because not a lot of people have had it, and there are symptoms of arthritis reported. So even though they were getting vaccinated, they were still experiencing this arthritis pain, and doctors found out about it and they're like, well, we don't really want to prescribe it to people in these areas that it's more prevalent in, just because they're still seeing the signs and symptoms even though they haven't been bit by a tick yet. Otzi the Iceman. He was discovered in the Ötztal Alps between Australia and Italy in 1991. They found out he was alive 5,300 years ago and had evidence of Borrelia burgdorferi in his bones. They estimated he was around 45 years old, and he had brown eyes, type O blood, and know what loincloths he preferred. They found a lot of evidence and found a lot of extra information about Otzi. They said that he was, right after he died, he was frozen in the ice and the snow up there, so his body was preserved very well. They know that he was killed by an arrow, what skin color, eye color, blood type, and then obviously he had Borrelia burgdorferi in his bones, so this was the original case of Lyme disease, and this was discovered that it has been around for a long time and we still don't have a solution for it. So this is kind of pushing scientists around the world to say, hey, this has been known, this has been a problem for how long, how can we finally solve it? This slide also includes why is this important to discover Otzi. This discovery can help us tell how this disease evolves, how it affects bones, and understand how in patients today with Lyme that have osteoporosis and osteoarthritis, and just understand how it affected his bones over the years and how we can correlate to how that will affect the people who have Lyme disease bones, and kind of see how it will grow and develop in them. So one important thing about this is prevention. So number one, we want to wear long pants, a long shirt, and shoes that cover a whole foot. We want to remove clothing after being outdoors and wash and dry them at high temperatures to kill off any ticks that would be in our clothes. We want to avoid woody, brushy, and grassy areas. And while hiking, walk in the center of the path. Number 4, you want to wear insect/tick repellent. Number 5, wear light colored clothing so you can see the ticks better. Number 6, do careful and thorough body checks after outdoor activities. This does not include just yourself, it includes your kids, if you have any family members, dogs, pets. Just remind yourself and others to do thorough checks because if it is not discovered soon, it could lead to long-lasting effects, and just to be aware of those signs and symptoms. So this is what a typical tick habitat looks like. As you can tell, it looks like Wisconsin woods, especially you can see in this picture the seasonal changes in tick activities. The adult female tick, it happens in the fall. So we really want to be careful in the fall, especially hunting season, to make sure when we're going outdoors, hunting, fishing, being outside, that we're checking our whole body for ticks so we can avoid Lyme disease. And then sometimes there are warning signs out. They can be red or yellow. So tick repellent Roundup. So you have D, Picardian, oil of lemon, eucalyptus, essential plant oils, and the Picardian was the one that can maximize protection time the best, with it being just under or equal to 12 hours. So this is the one we want to lean towards and make sure we're putting on, especially if we know we're going outdoors in taller grass. What to do if you think you have Lyme disease. So phase 1, step 1, remove the tick properly, making sure you have the whole thing, and you can put it in a Ziploc bag just in case your doctor asks questions or asks for it. They can also do tests on the tick so they can tell if it carries Borrelia burgdorferi or not. Next, you want to call your doctor, your primary, and let them know that you suspect you have Lyme disease. Tell them what signs, symptoms you have, when you got exposed, if you have a rash or not have a rash, and how long you think you've had it, or how long you've been bit by, or the last time you have gone outside in those typical areas ticks seem to be. Phase 2 or step 2, your doctor can diagnose you and get you started on antibiotics and maybe do further blood testing if they think it's necessary. If you do experience any serious symptoms like trouble breathing, or it seems like your heart is beating a little slower, you feel faint, dizzy, you want to go straight to the emergency room. If you wait and you do if it does develop into a chronic illness, you need to make sure you tell your doctor as soon as you suspect you are having these serious symptoms or chronic symptoms that do match up with Lyme disease, so you can get on antibiotics and treatment and any further planning. Why is it important to catch early compared to catching it late? So if you catch it earlier, it is treated with antibiotics and symptoms go away very quickly. This is clear up fatigue, fever, and the rash if you do have it. If it's not caught early, it can lead to joint pain, heart problems, and neurological problems like numbness or memory loss. If it spreads to the heart, it can cause the heart to beat too slow, causing fainting and chest pain, along with shortness of breath. Treatment and what to expect. So for early Lyme disease symptoms like rash and flu-like symptoms like chills, fever, fatigue, they can prescribe doxycycline twice a day for 10 to 14 days. If it is a serious or late-stage Lyme, that includes joint pain and neurological symptoms, treatment could last 21 to 28 days with doxycycline, and then they could potentially add in another IV antibiotic or IV fluids. So doxycycline works by blocking the bacteria's ability to make proteins, and this interferes with their survival because they can no longer multiply and get into that immune system or bones or anything. So this is kind of where it stops in our body. This slide just has my references and where I got all my important information in this slideshow. I just wanted to include this last slide just to wrap everything up. So it is important for us to know about it, especially in Wisconsin, because we are one of the main hotspots for Lyme disease. We know that it's carried by a deer tick, which is smaller than our fingers, so we need to really be aware of that. It is caused by Borrelia burgdorferi, which is the bacteria in Lyme disease that causes Lyme disease. That's carried by a black-legged tick or a deer tick, and they normally hang out in wooded areas, long grass, brushy areas like Wisconsin woods, tall grass. If you go hiking, make sure you're in the center of the path. It needs to bite you for 36 to 48 hours, but just make sure if you do have a tick, to remove it fully, and then call your doctor if you have any signs and symptoms. Especially in the first stage, we really talked about that rash. 80% of people have that bullseye rash, so you really need to be aware of it. But if it gets the second or the third stage, where you're really having problems following conversation, you're dizzy, you have heart problems, you're experiencing memory loss, we really need to make sure we're getting into the doctor and giving them all the signs and symptoms you have, because you could need antibiotics to treat Lyme disease. We also talked about prevention. So we need to make sure we're wearing long clothes that cover our whole body. We're wearing insect repellent, especially tick repellent. We talked about Precardian, which is one of the main tick repellent that works up to 12 hours. It was the best result one that we looked at. Prevention also includes making sure you're wearing lighter clothes, making sure every time you're going outside in these main areas that you're checking for ticks. It doesn't include just yourself. Remind your friends, your family, and they can also be on your pets, so it isn't a bad idea to check them regularly. We talked about how important it is to catch it early, because signs and symptoms will go away with antibiotics, whereas if you catch it late, these antibiotics may not work all the time. And then if you do think you have, is to catch it early, because signs and symptoms will go away with antibiotics, whereas if you catch it late, these antibiotics may not work all the time. And then if you do think you have it, remove it, call your doctor. If you are experiencing trouble breathing, dizziness, heart problems, go into the emergency room, so you are not just sitting here having trouble breathing or heart problems, because it could be Lyme disease bitten by a tick that you didn't see any tick on you, but you're experiencing these weird symptoms. It is important to go get it looked at in the ER. So thank you for listening. I hope you learned something educational and start reminding others to check for ticks, especially during hunting season in the fall.